But you know,
Cheryl Edmondson can now laugh when she looks back at photos taken just before she had liposelection. But just a few months ago, her weight was no laughing matter.
I was diagnosed as a type 2 diabetic.
Cheryl is a nurse, so she was determined to improve her health.
I'm an example in the community, and there's no reason I should be having extra weight. I've had trouble losing weight for the last, well, I always say I have the baby weight from my last child, which she's now 17.
Cheryl started looking for options to make her weight loss faster and easier. She found an ad like this one in a magazine.
I decided, wow, look at the before and after pictures. And it was amazing. So I thought, you know, I'm just going to go talk to him.
So she came here and met with Dr.Taylor about liposelection.
I was very clear with Cheryl that we needed to add weight loss to this whole process. This is not a weight loss procedure, it's a body contouring procedure.
I wanted to know all his background, how many times he had done this procedure, what's the infection risk, the typical nurse questions. By the time we went back to do the procedure in another room, I felt totally comfortable that this is what I wanted to do, and I'd do it again in a minute.
Here's how liposelection works. This shortening in a glass of water shows how fat is stored in the body. When an ultrasound probe is placed next to the fat, it emulsifies.
It's actually ultrasound that's generating the energy, and therefore you don't have to worry about thermal injury of the tissue. It's not a heat-generated system. Ultrasound is what's generating the energy.
The procedure actually involves 3 steps.
First, you infiltrate with lidocaine and saline. So you use a probe, you're underneath the skin, you're above the muscle, so you're in the fat tissue. So you infiltrate with the lidocaine, and that provides the anesthesia for the procedure. So it's a local anesthesia.
Next, the fat is emulsified.
So you're emulsifying the fat tissue, and that's the difference between liposelection and liposuction, is that step. You're emulsifying or you're liquefying the fat. So now you can go to the third part of the procedure, which is the evacuation of the fat with a suction, a non-traumatic suction. I
just laid there kind of laughing, thinking, there's a McDonald's cheeseburger, there's a Big Mac, there's a Whopper. I'll never do those things again. So it's kind of neat to see that that's actually what you've eaten. And now when I make choices, I think about that canister of fat. I really do. It sounds crazy, but I really think to myself, okay, apple or, you know, apple pie, and you're like, I'll take the apple.
But Cheryl has done very well. She's going to continue with the weight loss program, and hopefully we'll avoid any other liposelection because she'll be able to correct any other contour issues or weight issues with just by losing the weight.
Cheryl's been dieting, but she says she could see immediate results that gave her motivation.
So I felt extremely motivated after the procedure. I didn't say, okay, the procedure's done, I've lost weight, I don't need to go any further. I continued on the program, still am on the program, and probably will be for a long, long time.
Dr. Taylor's colleague and wife, Dr. Taylor, has also tried liposelection as well as other contouring methods like LipoDissolve.
Well, I've actually tried all the procedures that we offer here, liposelection, mesotherapy, and LipoDissolve. And basically, I had it done on a Friday. I was back in the office on Monday. And I wanted to experience it from a patient's perspective so I would know what to expect. I just think it's a great procedure. You get the results that you want. It doesn't disrupt your life. And it's not uncomfortable. That's the great thing about it. Most people are concerned about how uncomfortable and what is the recovery time.
The Taylors offer all types of body contouring procedures, and they say different methods are suited for different body types. Liposelection is among their top recommendations because it has few complications.
To me, this is a procedure that gives the maximum results with a minimal amount of risk. And you can almost ask any physician, that is what you're looking for. What can you get an immediate, significant result without a lot of risk? And liposelection allows me to do that. They get on that day, they see a difference in their appearance.
It's a great procedure. It's for patients who would never consider liposuction. And it doesn't target blood vessels or nerves. So it basically ignores everything else around it except the fat cells.
Cheryl knows there are no quick fixes, but liposelection has helped her gain the confidence she needed to stay on track.
I feel like, I've gained my life back.